Okay, great. So I know most of you, and we haven't met before. So my name is Danny Quaranto. I'm an acupuncturist. I've been an acupuncturist for about 27 years. And I'm going to kind of talk to you a little bit from that perspective of an alternative medicine person, but I also want to give you the true perspective on cholesterol, because there are two major camps, and the alternative medicine people pretty much tell you most of the time that cholesterol is no big deal, don't worry about it, you know, they're just trying to take your money, it's a big scam, don't worry about it. And the conventional medicine people are going to tell you this is really important, you have to take care of this, cholesterol is important, or if you don't take care of it, you're going to die. So the truth is really someplace in between, in the middle. And through really isn't a big deal, but it becomes a big deal if you have some aggravating situations. And we're going to talk a lot about a lot of those aggravating situations tonight. I guess the first thing I want to kind of get across to you is that cholesterol is not a bad guy. You need to have cholesterol. Most of your brain is made from cholesterol. All of the cell walls, every cell wall in your body is made from cholesterol.
And with cholesterol?
Cholesterol.
In general.
Cholesterol, and we'll talk about, you know, what's considered the good and the bad cholesterol, definitely. But cholesterol in general, because there isn't any really bad cholesterol or good cholesterol, it's just terms that we use, and we'll talk about that in much more detail. It's a good question. But cholesterol, the point is that you have to have cholesterol. All of your hormones come from cholesterol. This is a really important thing, and not a lot of people, and I get blood work from people from having had their blood work at other doctor's offices, and they're on cholesterol medication, and their cholesterol is 110, and the doctor's trying to get their cholesterol down to 100. It just tells me that that doctor forgot what it is that they learned in medical school about cholesterol. So most of the things that I'm going to be talking to you about are really things that you can verify in the literature, the scientific literature. This is not Dr. Danny alternative medicine opinion about cholesterol. I'm going to give you information about cholesterol that's really going to be based on the science. Okay? So let's take a look at cholesterol first, so just we can leave this whole thing about cholesterol being bad. I want to show you where hormones come from. So here's cholesterol. Okay, so and the normal range for cholesterol should be between 150 and 200. Now, when I see the laboratory reference ranges from lab work that people have had done, the laboratory reference range will say that the normal cholesterol should be anything less than 200. Well, what I'm going to show you here is true, and it is true. Then having your cholesterol be 0, anything less than 200 is okay from the laboratory reference range, is insane. So why would this reference range in the labs be so low? The reference ranges at the labs come from the people that go to that particular lab. If you go to a different lab right here in town, you're going to see a different reference range for all the markers: cholesterol, TSH, thyroid markers, BUN, all the different markers, anemia markers. They're all going to be different reference ranges. These numbers come from the people that go to the labs. So if you realize that the laboratory reference ranges come from the people that go to that lab, then the next question you need to ask yourself is, who goes to the labs? So let me ask you, who goes to the labs? Sick people go to the labs, yeah. Sick people go to the labs. So if sick people go to the labs, and these are the reference ranges that the laboratory has determined is a normal person, then what is this person? Is this person is just barely inside that reference range? Is that a normal, healthy person? These are sick people. Are these normal people? No, the normal healthy person range for the lab should be much narrower. This is what I want to get across to you. So these numbers here for the cholesterol being less than 200 are so low because so many people go to the lab that are taking cholesterol lowering medications. And I've seen people below 100. So this is not the normal healthy person range here. The normal healthy person range for cholesterol as determined by the National Cholesterol Education Program is between 150 and 200. So if you start going below 150, here's what happens. From cholesterol, you get a little enzyme that comes in here and it turns that cholesterol into this substance here. Turns it into pregnenolone. Now, another name for pregnenolone is the mother of all hormones. All your hormones come from pregnenolone. So if you're not making enough cholesterol, then you're not going to make enough pregnenolone. If you don't make enough pregnenolone, here's what happens from pregnenolone. From pregnenolone, you get another enzyme that comes in here and it makes testosterone. You have another enzyme comes in here and makes estrogen. You get another enzyme comes in here and makes progesterone. You get another enzyme comes in here and makes DHEA. You get another enzyme that comes in here and makes androstenedione. You get another enzyme that comes in here and makes cortisol. Okay. So, let's look at this. If you're not making enough cholesterol, then you don't make enough pregnenolone. If you don't make a pregnenolone, then your body is going to have to make a choice of which one of these guys am I going to make. Well, reproduction is not a priority. You're not going to make these ones here. You'll make this one over here, cortisol, because cortisol is important for survival. You don't have enough cortisol, then you die. So it's kind of important. So your body will, if you're not making enough pregnenolone, everything will get shunted over here to make cortisol at the expense of testosterone, estrogen, progesterone, DHEA, androstenedione, and some other hormones also. So just so you don't say, I don't care, I don't have sex anyway. Well, hormones are much more about, hormones are about so much more than just sex. You have testosterone, estrogen, receptor sites in your eyeballs, your hair, your skin, everything, your organs, your brain. Your brain has hormone receptor sites in it. So if your brain wasn't getting the hormonal stimulation that it needed, what kind of symptoms could you have? How about anything? The brain runs the show, right? If your brain isn't functioning properly, nothing's going to work properly. So cutting back too low on cholesterol is not a good idea. That make sense? Okay, so this is where we are right now. And this is taken from the Center for Disease Control. Right now we are talking about heart disease being the leading cause of death in both men and women in the United States. Unbelievable, huh? And I want you to remember this because we're going to come back to this, okay? Now, when we're talking about cholesterol, most of the time we're concerned about cholesterol because of the plaquing on the artery that we get partially from cholesterol. And the word that we're interested in is this atherosclerosis. Athero is meaning like athero is like paste, gruel, like oatmeal that hardens. And sclerosis means hardness, okay? So it's hardness of the substances inside the arteries, and that causes plaquing. Now, just to give you a picture of what plaquing on the arteries means, what hardening of the arteries means, I was at a dissection class one time, and we had a cadaver on the table, And we took this woman, opened her up, and we were tapping on her aorta, just like this. And so we said, wow, you know, this must be, she must have a stent in there. And so we looked around, there were no surgery suture marks. So we took a piece of her aorta out, and we cut it down the side here, and we opened it up, pulled out the plaque. The plaque was like a clamshell. It was like a clamshell. Like you go down the beach and get a clamshell, that's what it was like. So when somebody talks about plaquing on the arteries, it's not like this latex material that builds up on the inside of the artery and closes down, closes down. It gets built up like a clamshell. And there's no flexibility in there, and so if there's no flexibility, the arteries can't expand and contract the way that they're supposed to, then you end up getting high blood pressure too, right? So this atherosclerotic plaque is made from fat, cholesterol, cellular waste product, calcium, other substance, and the buildup is called plaque, and hardening of the arteries is the term that most people use. And so you have a picture of hardening of the arteries now, right? Okay.
Did she die of heart problems?
She might have, because this poor woman had so much done to her. She had her large intestine was removed, her gallbladder was gone, her uterus was gone. She had a Gore-Tex artery it was about this big in diameter, and it's about 1/4 of an inch in diameter, that was running from her hepatic artery down to her femoral artery, because she had a blockage in the lower abdomen. So it was like this stuff that was inside of her body. It ran from here down to here to bypass this whole area here. And then she had another piece of Gore-Tex that was running from her mesenteric artery there down to the other femoral artery so that she could get blood circulating into the legs. It was like Frankenstein stuff. It was unbelievable. So, don't get plaquing on your arteries. Okay, so we're going to talk mostly tonight, we're going to talk about some other things too, but we're going to talk about mostly the thing that everybody's afraid of, the cholesterol model of cardiovascular problems. Okay. So let's take it from the beginning. This guy named Anitikov back in 1913, he went to an autopsy, and for this person that had died of what was, not really very common back then, died of a heart attack. That wasn't very common back at that time. And so in the autopsy, what they did is they did kind of like what I just described to you with the woman that I was. They saw this plaque buildup on the inside of the arteries, and they took it and they analyzed it, and there was a major portion of it was cholesterol. So Anitikov made a hypothesis that the reason people die of a heart attack and the buildup of plaque in the arteries is because of excess amount of cholesterol. And so what he did is he did this experiment with some rabbits. Kind of interesting experiment. He took these rabbits, a bunch of rabbits, and he injected them all with a cholesterol that was stabilized in a solution of hydrogen peroxide. And so what happened was all these rabbits developed atherosclerosis, plaquing on the arteries. They all did. So, that was the beginning of the whole cholesterol picture. Here we go, we inject these rabbits with the cholesterol solution, and they all get plaquing on the arteries. So that must be the culprit. So that held true from 1913, and in 1950, then Goffman identify the LDL and the HDL, and this is what most people consider the good cholesterol and the bad cholesterol, and this is what you were asking earlier. So LDL, low density lipoprotein, HEL, high density lipoprotein. So why are these the good ones and the bad ones? High density lipoprotein, low density lipoprotein doesn't really help us very much, does it? I'm going to give you my mom's system for figuring out which one of these was which, and you'll never forget it. Okay? So why is this one the bad one? This one is considered the bad one because what this one does is it brings cholesterol from your liver out to the arteries. This one's considered the good one because it brings cholesterol from your arteries back to your liver. Now you can understand that if cholesterol is doing all of these things here, that you need some cholesterol going from the liver to where it's supposed to go, right? That makes sense? Cholesterol is a good substance in ways. You have to have cholesterol to help you with all kinds of healing. When you get a cut, part of the scar mechanism is cholesterol. And you don't want to be having too much coming back from the arteries back to the liver, because so you get the idea. This is about a balance of the good and the bad. So, but most people consider, okay, I don't want to bring any cholesterol out to my arteries, and I want to bring all the cholesterol back from the arteries back to the liver. So my mom's method of figuring out which one of these was which was, this is the lousy one, and this is the happy one. Okay, so you want lower lousy ones, and you want higher happy ones. So the range should be something like, on your blood work, if you look at your blood work, the lousy one should be below 120. And the happy one should be above 55 to 100. 55 to 100 is normal for the HDLs. And you don't want it to be too low. One of the reasons, if that's too low, one of the things that they do in your blood panels, when you look at the markers for the total cholesterol and the triglycerides and the HDL and the LDL, they take and they divide that HDL number, the good cholesterol, and they divide it into your total cholesterol. And that gives you a number. On your blood work, that number should be less than 3.1. The higher it is above 3.1, then the more susceptible you're going to be to having heart problems. So that's the cholesterol HDL ratio. So he was the first one to identify that idea, the whole idea of the good and the bad cholesterol. And then in 1970, only 20 years later, Braun and Goldstein discovered this HMG co-reductase pathway. Now, and I wrote that out there because that's those drugs that they use to stop the liver from making cholesterol. That's what they call. They're called HMG co-reductase inhibitors. They stop, inhibit. ASE means it's an enzyme. Enzymes make things happen in the body. So what they do is that Lipitor is an HMG co-reductase inhibitor. It prevents this enzyme from doing its job of making cholesterol. That's part of the reason why when you go to and you have cholesterol medication, part of the reason you need to go and have your liver enzymes checked every month is because these medications have a very strong effect on the liver. So in 1976, six years later, Akira Endo produced the earliest statin drug from a natural substance that you can buy at the health food store. And I have here, and I use it not very frequently, and I'll tell you why. But it was made from red yeast rice extract. Okay, so, and now red yeast rice extract will work as good as Lipitor does. It will, however, have some of the same side effects that Lipitor has too. So this isn't something you have to just, it's a natural substance, just take it and it's not a problem. You have to watch out for it even when you're taking a natural substance. It's very powerful. And so why, if it works so well, why did they just let people take red yeast rice extract? Because you can't put a patent on a natural substance. There's no money in having people take red yeast rice extract. That's why. And so the whole, in 1988, because they finally discovered the mechanism to shut off the production of cholesterol, 1988, they predicted the eradication of heart disease by 1998. They're saying 1988, They say 10 years from now, we'll be rid of heart disease and elevated cholesterol is going to be history, and this is where we are now, right? 2013. Heart disease is the leading cause of death for both men and women in the United States. So we really haven't come very far, have we? Now, this is interesting here. This thing here, pain. This is a study that was done in a clinical laboratory analysis in 1991. What this did, you can see the asterisk up here. Pang refuted the whole pillar that the cholesterol model was built on in 1991. So what Pang did, Pang went back and got the same species of rabbits that Anitikov used back in 1913, got the same species of rabbits, and he injected all the rabbits and he broke them into 3 groups. One group of rabbits got the same exact solution that Anitikov used, the solution of the cholesterol stabilized in the hydrogen peroxide, and then he did another group of rabbits that he just injected cholesterol, and then he got another group of rabbits that he just injected the hydrogen peroxide. So guess what happened? All the rabbits that got the cholesterol with the hydrogen peroxide solution got plaquing on the arteries, the same way that Anitikov back 100 years ago got. Well, almost 100 years. Do the math for me, John. The rabbits that had the injection of just the hydrogen peroxide, they got plaquing also. No cholesterol, just the hydrogen peroxide. Now why? Because hydrogen peroxide is a waste product. Your body gets rid of hydrogen peroxide. Hydrogen peroxide is a very inflammatory substance for the system, for the body. And this is what cholesterol does. Cholesterol is like a Band-Aid. So that's why I'm saying cholesterol is not a bad guy, it's a Band-Aid. So if we're looking at inflammation as an assault on tissue, we want to put Band-Aids on it, what do you think happens if you have a tube here like this and you keep on putting Band-Aids on it and putting Band-Aids on and putting Band-Aids on because of the inflammation that you're having? Our diets, our lifestyle, the stuff that we're exposed to in the environment causes inflammation in our system. And cholesterol is your body's attempt to try and fix the inflammation. So you keep on building up and building up the plaque on the inside of the arteries because of the inflammation. It's not the cholesterol that's the problem, it's the inflammation. And that group of rabbits that just had the hydrogen peroxide injected, they got plaquing in the arteries. The group of rabbits that had just the injection of cholesterol, nothing. No big deal. Nothing happened to those rabbits. There was no change. That's profound, isn't it? I mean, and the thing is that the whole premise of treating people nowadays hasn't changed from back here when they were trying to figure out how do we get rid of cholesterol. And I see it. I see it every day. I see people bring their blood work in, and their cholesterol is they're much lower than 150. I've seen, like I say, I've seen it, below 100. So, not a good idea to have your cholesterol too low either. Now, you get the idea when I first started this whole lecture that cholesterol is not good, it's not bad. There really is a factor with cholesterol in causing plaquing on the arteries, but it's not the whole picture. We'll talk about some of the other reasons why too. So, Lipitor is the second most prescribed drug in the United States at this point. And this is it. The standard of practice in medicine hasn't been changed at all. The number one drug, you're all asking, okay, what's number one? Hydrocodone is the number one drug that's sold in this country. Now, here, this slide is beautiful because what this slide is going to tell you is the reasons why you have elevated cholesterol. Now, most people have very strong opinions about what kind of dietary influences are going to cause people to have elevated cholesterol. Now, these reasons why people have elevated cholesterol are taken from this book here, the Handbook of Interpretation of Diagnostic Laboratory Tests. Okay, this is not, again, Dr. Danny's Alternative Medicine, Reasons Why People Have Elevated Cholesterol. This is the book that they use in medical school to teach the doctors what do these lab tests mean. Why is this low? Why is this high? This is the book that they use. So, in descending order of why somebody would have elevated cholesterol, the first reason somebody's going to have elevated cholesterol is going to be insulin resistance or diabetes. That's a sugar deal, isn't it? If you have insulin resistance or diabetes, you're going to have elevated cholesterol. The second reason somebody has elevated cholesterol is going to be a low thyroid, hypothyroid. Now, how does it make sense to give somebody cholesterol-lowering medication when the reason that their cholesterol is elevated is because they have a low thyroid gland? And I've seen many people over the years that they come in and they have a low thyroid, they have elevated cholesterol, they go together like this. I get the thyroid working better, the cholesterol goes down by itself. But why not just give somebody medication for the rest of their life that lowers the cholesterol? The next reason somebody's going to have elevated cholesterol is a diet high in refined carbohydrates. That's another sugar deal, isn't it? How many different ways can you say sugar? Sugars, sweets, carbs, starches, rices, pastas, breads, cereals, grains. It's sugar. That's the third reason people have elevated cholesterol. And what I want you to see at the end of this list here, I want you to see what's missing down here in this empty space here. I want you to see what's missing as to why people have elevated cholesterol. The next reason people have elevated cholesterol is going to be pancreatic dysfunction. Pancreas, diabetes, insulin, that's another sugar deal, right? Next reason somebody has elevated cholesterol is going to be hepatobiliary dysfunction. Hepato is liver, biliary is gallbladder, that whole liver gallbladder system. Your liver makes cholesterol and your cholesterol binds to the bile in your gallbladder. When you circulate it and get rid of it, your bile gets rid of it. They used to use a whole category of drugs called bile sequestering drugs, which would help the cholesterol bind to the bile in your gallbladder and help you to pass it out quicker. But it caused a lot of gastrointestinal symptoms, if you can imagine that. And so they stopped, it's not used very much. So the next reason you're going to have elevated cholesterol is going to be kidney problems. Next reason after that is going to be family history. After that, it's going to be pregnancy. Yeah. So somebody, so when that happens, people get all kinds of problems in pregnancy that are that'll actually go away after the pregnancy is finished. Diabetes is one of those things. And then the last reason is going to be steroids. So, what do you see missing? As to reasons why people have elevated cholesterol, what you see missing here, you don't see any reference down here to butter, eggs, meat, or fat, right? No, it's sugar. Sugar's a big culprit for causing people to have elevated cholesterol. Now, that doesn't mean you can go out and indiscriminately just eat anything you want, because there's good fats and there's bad fats. The bad fats are really bad. Things like partially hydrogenated vegetable oil, trans fats. I can't believe it's not butter. Those types of things. Smart balance. That are technically not really trans fats. They use a process called esterification when they make those products, those things that say they're not trans fats, but they're kind of like, they used to be oil and then now they're not oil, so they have to do something to it. They have to change it to make it different than it was when it was in nature. So they use this process called esterification, where they use a couple of things in that process that are actually carcinogenic, like hexane. No, ooh, it's a poison. But they use it in the processing of these things. Doesn't mean it's in there now, but.
What about what they call the left-handed sugars, like sucralose and things like that?
Yeah, sucralose.
The reverse molecular.
Oh boy. Okay, so let me tell you a story about sucralose. Splenda.
Splenda.
Yeah, Splenda. So, and this is when Splenda first came out, I kind of bought into the advertising that they did. You know, this is made from sugar, so it tastes like sugar. I figured, okay, it's closer to a natural substance. And maybe because I was kind of looking for something, because my mom was diabetic, so I wanted to try and find something for her. And I said, oh, maybe this will work for her. Okay, so it was Thanksgiving coming up, and I wanted to make her a cheesecake for Thanksgiving. So I got some ricotta cheese and put some lemon peels in it and orange peels in it and some nuts, and I got a bunch of pistachio nuts, and I smashed up the pistachio nuts and made the crust from the pistachio nuts, and I sweetened it with Splenda. And so I brought it over the house, and she loved it. It was great. I had a piece of the cake, the pie. I started getting palpitations. So I said, okay, this can't be too good. So then I started to do a little bit more research on Splenda. And what I found is that Splenda is the only organochlorine that's been okayed by the FDA for human consumption. Now, a couple of you people are old enough to remember DDT. DDT was a insecticide back in the 60s that was sprayed all over the country. And a woman named Rachel Carson wrote a book called Silent Spring, because the DDT killed all the birds. They ate the bugs. The bugs were dead. They ate the bugs, killed all the birds too. So we had a silent spring till the bird population came back. So the chlorine gas that they use in chemical warfare, it's an organochlorine. They discovered Splenda by accident when they were trying to make an insecticide. So I would say, you know, what you really need to do with Splenda is just give it to somebody you don't like. Okay?
So what do you think about stevia?
Stevia is made from the leaves of a tree in South America. It's a natural product.
Sure.
Yeah, but let me say but. I've seen a lot of stevia products that actually have sugar in it. And it's like I said before, how many different ways can you say sugar? They put maltodextrin in it, which is made from corn sugar. And corn is, I mean, a lot of corn sugar. The high fructose corn syrup is unbelievable. There's no way you can digest high fructose corn syrup. All the corn in this country has been genetically modified. And you know why they genetically modify the corn? They genetically modify the corn so that it's resistant to Roundup. Isn't that sick? Roundup. You know, if you're not sure what Roundup is, Roundup is an insecticide. Roundup is a herbicide. You spray it on the grass and it kills the weeds. So they make it so that they genetically modify it so that the corn is okay with Roundup, so they can take airplanes and spray the crops with Roundup, and the corn is okay, and all the weeds underneath the corn die. Nothing else grows except the corn because they genetically modified it. Isn't that nice?
Is that the main thing about high fructose corn syrup? Is the big booger right now about saying no, none of that? Is that
Because it's genetically modified? No.
No.
You don't have any enzymes that allow you to be able to.
We just can't digest it.
You can't digest it, and it will cause insulin resistance faster than anything. Insulin resistance, diabetes. You have to come to the diabetes lecture for that talk.
I guess I better
But
quit eating Carol.
it's pertinent to what we're talking about here, isn't it? Because the first reasons for somebody having elevated cholesterol is insulin resistance, diabetes. So high fructose corn syrup is really killer. Oh my God, I shut that off, okay. Here we go. All right, so sometimes I like to go to Ruby Tuesdays.
That's pretzel burger.
Huh? That's a triple prime. That's a triple prime burger from Ruby Tuesdays. So I go in most of the time and I tell them, "Can we have a triple prime burger, rare, no bun, no fries, please?" Well, I had my camera this day, so I said, "Just bring the burger." So this is what the burger. This is how the burger comes out. And so I took the burger out of the bun. I put the bun over here. So that's lunch. Now, based on what we've been talking about, and this is what's left over here, right? Based on what, whoops, I ruined the whole show, didn't I?
No, we didn't say it. We didn't say
Didn't see it.
So they have it.
Oh, Greg was it, we didn't say it.
This is what causes the elevated cholesterol, not this. You got it? This is not going to jack up your cholesterol like this will. So, this is a beautiful story. Now, one of the, and you know, some of you may have, or if you're not doing it, you may know people that are taking cholesterol medication and they don't really have cholesterol elevated, but they have maybe family history or they had some other kind of medical issue and the doctor decided that, you know, you really should go on this cholesterol medication because it has some other benefits besides lowering cholesterol. It has some other benefits to it. So here's what they're talking about in this case. So see this stuff here, the C-reactive protein, C-reactive protein. Okay, C-reactive protein is a very inflammatory substance. Did you hear the word again? Inflammation, inflammation, inflammation. Inflammation is going to cause the cholesterol to be elevated, isn't it? Because it's the cholesterol's job to put the Band-Aid on the place where the inflammation is. And we're talking about atherosclerosis packing up on the arteries. So the C-reactive protein is one of the, and sometimes you see a little HS on there, and that's more specific for inflammation in the heart, the arteries in the heart. It's the C-reactive protein. So this drug company, the cholesterol-making drug company, did a study, and what they found was that statin drugs will lower C-reactive protein. So you know they ran around to all the doctors' offices with that piece of paper from the study, the abstract on that study, showing, you know, this Lipitor is going to lower the C-reactive protein. We need to put Lipitor in the water supply. Everybody needs to get Lipitor. It's going to save lives. You know, look at what we've been able to do. And so, and believe me, a lot of doctors that are in the country now are still prescribing statin drugs based on that piece of information. Now, what the drug companies didn't do with the same fervor was to run around with a piece of paper from the follow-up study. Here's what the follow-up study showed. The follow-up study showed that, yep, we can lower the C-reactive protein with a statin drug. But what they did in the follow-up studies, they went back the next step further to see where did C-reactive protein come from. It comes from the liver. Well, okay, how come? Well, all of these inflammatory substances up here, these are all inflammatory substances. The IL stands for interleukins, and there's different numbers. They're all inflammatory substances. They're not bad. These are things that your body needs to help to, you know, to fight infections. But when they get excessive, then they become inflammatory also. And if you have like an autoimmune condition where your immune system is really fired up, you can be making a lot of these substances up here, and actually you'll be attacking certain organs. That's the autoimmune workshop. You have to come to that. Okay. So anyway, these are all the interleukins here. This is tumor necrosing factor, and interferon. You might have heard about some of these things. But what happened was in the study again, they showed, yep, the statin drug will lower the C-reactive protein. But they go back and they look at these and there's no change in these. Nothing changed with the inflammation that's in the blood here. The only thing that the statin drug did was it destroyed the liver enough so that it wasn't able to put these things together to make the C-reactive protein. Now, again, why do you have to go to the doc? Why do you have to go to the lab and have your blood checked every 3 months when you're taking a statin drug? Because it affects the liver. Okay? So, you have to watch out for studies. You have to really be careful because, like I say, there's still doctors out there that are operating on the original study. With all of the best of intentions, God bless them, who the heck can keep up with all the research, right? And the drug companies are only going to tell you what it is that's going to help them sell more drugs. Now this is another interesting substance. It's an inflammatory substance. Homocysteine is an inflammatory substance also in the blood. Now, homocysteine, you're not going to have any symptoms of homocysteine. It's a cheap test to get. If you've got any kind of cardiovascular issues, when you get your blood checked the next time, you want to get it checked for homocysteine. You also want to get it checked for C-reactive protein, but if you're taking a statin drug, then forget about it. It's not going to be an accurate picture of what's going on, right? It's not going to tell you whether or not you have inflammation. But this one here, homocysteine, like I say, it won't have any symptoms, and it's a cheap test, and it's easy to get rid of it with natural substances. You can get rid of homocysteine with natural substances. Things that help build up the function of the liver, the methylation pathways, different pathways in the liver to get rid of this stuff. But the implication of homocysteine is, like you read here, if you've got elevated homocysteine, it will triple the risk of having a heart attack. Not something you want to have floating around in the blood, right? And if it starts getting up around, normal range is anything less than 7. It starts getting up around 10, 12, 14, then you got to really be careful, you know, then you want to do something about it. Interesting, homocystine's also been implicated in Alzheimer's disease. Because why? It's an inflammatory substance. It's inflammation. Interesting story about Alzheimer's. I had a patient that came in with his wife, and they wanted to see if there was anything that I could do about helping him with his Alzheimer's. So I was talking to them. It was a consult. We were talking, and I was telling them my take on Alzheimer's is that it's an inflammatory condition, and a lot of it has to do with that inflammatory condition happening because of insulin resistance. In other words, another name for Alzheimer's is diabetes of the brain. You'll see it in the literature. You can go on the internet and look it up. So I was talking, and I saw his wife smiling while I was talking, and I'm wondering what she's smiling about. I finished my story, and she said, you know, he's going to see his cardiologist, and he doesn't have diabetes. But his cardiologist, because of his Alzheimer's, put him on metformin. Metformin is a diabetes medication. She said he's reading so much better because it was helping with his, getting his blood sugar under balance. So now free radicals. This is another place that we're looking at the degeneration of tissues. So let me kind of give you a picture of when somebody says free radicals, antioxidants, do those make pictures in your head about what those things mean? I know a lot of people talk about antioxidants are good for you and free radicals are bad for you. If you don't have, I'm going to give you a picture of what the free radicals are and what antioxidants are. That will make a lot more sense to you than just talking about it with somebody. Okay, so this is the carbon atom, okay? And we're going to use carbon because we're carbon. We're mostly made from carbon. So the carbon atom, you got 6 of these protons in here, and you got 6 of these neutrons in here, and then you got 1, 2, 3, 4, 5, you got 6 electrons floating around out there, okay? So, so here's what a free radical is. I've got 5 out there. So what? Well, what this means is that this atom has to complete itself now. So what it does is it goes and it robs. It robs an electron from this atom. Now this atom is short. So what does it do? It goes and robs an electron from another atom. So what happens? Well, in this chain reaction here, how this chain reaction shows up in the physical body is tissue destruction, wrinkles, joints, not cartilage breaking down, degeneration of tissue. This is what free radicals do. They degenerate the tissue. So how do you fix that? You fix it by using antioxidants. So what do antioxidants do? They supply the electron. It stops that chain reaction from continuing and continuing and continuing. So that's free radical antioxidants, okay? Cool? Okay, now you see what I'm talking about here? This is about not cholesterol being the boogeyman, but all of these things that we're talking about are complicating factors that make cholesterol become a big deal. If it is there, all by itself, it's not a big deal. When you have these other complicating factors, it becomes a big deal. So we talked about the cholesterol model all by itself, and the inflammatory model, and the free radical model. We're going to talk about infectious agents right now. Now, we're going to assume that there's, I'm going to group these two together here, okay? So we got four different people that come in to see me. Everybody's got cardiovascular problems. So we're clear on that. Everybody that comes in has a cardiovascular issue, high cholesterol, blood pressure, the whole bit. So when somebody comes in, and this first person comes in and they have a history of reflux, heartburn, indigestion, you need to check that person for H. pylori bacteria, because H. pylori bacteria has been shown to cause plaquing on the arteries in conjunction with the elevated cholesterol, H. pylori. Interestingly, H. pylori bacteria, the estimate is that half of the world population is infected with H. pylori bacteria. And how do you get it? Well, French kissing your dog will do it. Okay, so don't do that anymore. But it is an infectious agent, and so when I find people that have H. pylori bacteria, I need to check the whole family, because you're going to keep reinfecting each other if you don't. So here it is, the most infectious disease in the world, and it's one of the causes of H. pylori bacteria, plaquing on the arteries. Interestingly, H. pylori bacteria lives in the stomach, but they don't like stomach acid. So the H. pylori bacteria has been shown what they do. They want to survive like every other critter. So what the H. pylori does is it burrows into the parietal cells in the stomach, the cells that make hydrochloric acid, and they shut the stomach off from making hydrochloric acid because they don't like hydrochloric acid. So what do you usually get when you go to the doctor and you tell the doctor you have reflux, heartburn, indigestion, GERD, those types of symptoms? You get what's called a proton pump inhibitor, things like Nexium, Prilosec, Acifex, all those things. What those things do is they stop you from making hydrochloric acid. So if you've got H. pylori bacteria down there and you're taking one of those things, bacteria, H. pylori is down there going, Yahoo! Thank you so much. And they'll if you have elevated cholesterol, you're going to have plaquing on the arteries because they've pulled H. pylori bacteria out of the atherosclerotic plaque also. So, the next person comes in, and this person has a feeling of, dragging themselves around. They feel like they got the flu, they got aches and pains, they've had it for a long period of time, they're dragging themselves. Got to check those people for cytomegalovirus and Coxsackie virus, because cytomegalovirus and Coxsackie virus have also been shown to cause plaquing on the arteries with the elevated cholesterol. Next person comes in, chronic cough, history of pneumonia, bronchitis, and just this constant nagging cough that they just can't get rid of. And what that person needs to be checked for is chlamydia pneumonia. Chlamydia pneumonia, another name for chlamydia pneumonia is walking pneumonia. So you can have pneumonia, walking pneumonia, you'll be able to function, you'll get around in the world, but you can have this nagging cough, tendency to have respiratory problems. So naturally, if I see a person coming in with cardiovascular problems and they also have a history of these respiratory things, then I need to check that person for chlamydia pneumonia also, right? And then the next person comes in, smiles at me with both of his teeth, and I'm going to have to check cardiovascular problems. I have to check that person for gingivitis, because that gingivitis has also been shown to cause plaquing on the arteries. And everybody knows that, when you go to the dentist, if you have, a lot of times you go to the dentist, they won't work on you unless you take an antibiotic prior, because they don't want you to have any dental pathogens getting into the bloodstream, especially if you have a heart condition. They won't treat your teeth unless you take an antibiotic ahead of time. Okay, so here's some of the markers that I might look at in the blood work to check and see if somebody has any kind of issues that I need to look at. You're going to look at the cholesterol, the bad cholesterol, the good cholesterol, triglycerides. One of the things that a lot of people don't talk about with cholesterol is what the triglycerides. The ratio of cholesterol to triglycerides should be 2 to 1. If your cholesterol is 200, triglycerides should be 100. The closer the triglycerides are to the cholesterol, more in a 1-to-1 type of a relationship, then the more you're going to be in a insulin resistance diabetes mode. Okay. Oxidized LDL is another marker that you can get to check. Oxidized LDL is oxidized. When I say oxidized, you can just substitute rancid. Okay, you have rancid fats rolling around in your arteries. Rancid fats, oxidized. C-reactive protein. Fibrinogen is one of the substances that causes the blood to clot properly. And if you have elevated fibrinogen, you really want to take care of that. And we used to tell people, if you got elevated fibrinogen, just go home and take care of your affairs, because it's inevitable you're going to get a blood clot, and it's going to either go to your brain or it's going to go to your heart and cause you to have a stroke or a heart attack. You all clear on stroke and heart attack what those things mean? They're the same thing, it's just they affect different areas. A stroke affects the circulation in the brain, and the heart attack affects the circulation in the heart. Okay. Lipoprotein A is a big deal. A lot of people make a big deal about lipoprotein A. It's probably not much better than regular LDL for a marker. Heat shock proteins, cytokines we talked about, cell adhesion molecules, tissue. Oh, that's an interesting one. Tissue antibodies. Sometimes your immune system is destroying your own tissues, like your arteries. Anybody ever hear of giant cell arteritis? It's an inflammation of the arteries in the temporal, and people get temporal arteritis. They'll have that temporal artery will burst, make you go blind if you're lucky. But it's an immune system reaction against your own endothelial tissues. Endothelial is the blood vessels. Okay. Now, when I say autoimmune reaction, does that make a picture for you guys? Yeah. And I know some of you, we talked about it before, but you know, your immune system is the part of your body that's supposed to protect you from the rest of the world. You know, it protects you against viruses and fungus and yeast and splinters, and you know, it's supposed to protect you against all these invading things that invade your body. Well, if you have an autoimmune condition, what's happening is that your immune system that's supposed to be protecting you against the world actually looks at a tissue in your body as if it was the enemy, a critter, a virus, a bacteria, and it goes on a rampage to try and destroy that tissue. And that could be thyroid, it could be Hashimoto's thyroiditis, it could be the nerve cells, and that could be MS, it could be the cartilage in the joints, and that's rheumatoid arthritis, and it could be the gut, the small intestine, that could be celiac disease. You get the idea. It's different tissues that get attacked by the immune system, and what gives that attack the name is what tissue it attacks. But it's the same process. It's your immune system attacking a particular tissue in the body. And here we're talking about it can attack the arteries themselves. And infectious agents, we talked about that. So, when sometimes I've had people come in and their cholesterol is like off the wall. And these are not made up numbers. Somebody coming in with cholesterol at 500 and triglycerides at 1200. I've had somebody like that before. Now, when you see something like that, that's a genetic problem, and there's a beautiful test to find out what category that you are in genetically. It's called a lipid electrophoresis test. It's not a lot of money, but what this test does is it gives you 5 different categories that you could possibly be in genetically if your cholesterol is off the wall like 500, 1200. And if you're in category 1, your elevated cholesterol is no big deal. That's the one you want to be in. Cholesterol's elevated, but it's not a big deal. The biggest danger you're going to have in your life is getting pancreatitis. You know, it's just you have an enzyme that's deficient and causing the elevated cholesterol. Now, type 2 A and B, those people, well, type 2 B and 3, those ones you have to kind of be really good with your diet. You have to eat like a monk. You have to really have a perfect diet. And that one's not the one we see most of the time. The one we see most of the time is this one here, type 4. Type 4 is a sugar problem. And that person that I just mentioned to you, 500 and 1200, I did this test on them, and that's what they were. They were category 4. So I didn't give them red yeast rice extract like I could have to lower the cholesterol. I got them getting a handle on their sugar, the insulin resistance, and their cholesterol and triglycerides came way down. So this is a sugar battle. Number 4 is a sugar battle, and in the medical textbooks they'll tell you if somebody is a category 4, don't give them statin drugs because the risk does not outweigh the benefit. So since there's no benefit, why take the risk, right? And number 5 is kind of like a combination of the other ones. Now this is the stuff that I was talking about. It's called Cholestar, and in Cholestar, which is the company that I use is Apex, and every company has its own particular name. So the name that the company gives this product that lowers the cholesterol is Cholestar. And so you can see that these are all the ingredients in Cholestar. The first one's inositol hexaniacinate. Inositol hexaniacinate is kind of interesting. One of the first recommendations of the National Cholesterol Education Program for people to lower people's cholesterol is niacin. Now, if you take niacin in a big enough dose to cause you to be able to lower the cholesterol, you're going to have hot flashes. As a man, you're going to have hot flashes.
Get hives.
Yeah, you will. And now, there's a non-flushing fund. One of the things that they give, people pharmaceutically is a time-release niacin, and it's a pharmaceutical, and you give that to people for lowering cholesterol. The only problem is it destroys the liver. So the time-release niacin is not good for the liver. Inositol hexaniacinate is a non-flushing form of niacin. You can buy it in the health food store. Inositol hexaniacinate. You can see it, niacin. Okay, you got niacin in the middle here. You got hexa, and then 8. Hexa, niacin, 8. Inositol hexaniacinate. That'll lower cholesterol. And it's in conjunction with the red yeast rice extract, which we talked about. That's the HMG co-reductase inhibitor that we talked about. That they made Lipitor from this stuff.